Welcome to today's video. In this video we will share with you breastfeeding in the first hour after birth. Breastfeeding is an important and natural process that provides optimal nutrition and benefits for both the mother and the baby. The first hour after birth, also known as the golden hour, is a critical time for initiating breastfeeding and establishing a successful breastfeeding relationship. In this article, we will explore the benefits of breastfeeding in the first hour after birth, the challenges that may arise, and how to overcome them. Benefits of breastfeeding in the first hour after birth. Breastfeeding in the first hour after birth has many benefits for both the mother and the baby. For the baby, breast milk provides essential nutrients, antibodies, and growth factors that support healthy development and protect against infections and diseases. Colostrum, the first milk produced by the mother, is rich in antibodies and provides important immune protection for the baby. Initiating breastfeeding in the first hour after birth also helps to establish a successful breastfeeding relationship. The baby's suckling reflex is strongest in the first hour after birth, making it easier for the baby to latch on and begin breastfeeding. Skin-to-skin contact between the mother and the baby promotes bonding and attachment, and helps to regulate the baby's body temperature and breathing. Breastfeeding in the first hour after birth also has benefits for the mother. It helps to stimulate the release of hormones that promote milk production and contraction of the uterus, which can help to prevent postpartum bleeding. Breastfeeding can also help to reduce the risk of postpartum depression and promote emotional bonding between the mother and the baby. Challenges of breastfeeding in the first hour after birth. While breastfeeding in the first hour after birth has many benefits, it can also present some challenges. Some mothers may experience difficulty with latch or milk transfer, particularly if they have had a complicated delivery or a cesarean section. Premature or low birth weight babies may also require special support and care to initiate breastfeeding. Mothers who have undergone medical interventions, such as epidurals or labor-inducing drugs, may also experience delayed onset of milk production. In some cases, mothers may also experience discomfort or pain during breastfeeding due to engorgement, sore nipples, or other breastfeeding difficulties. Overcoming challenges of breastfeeding in the first hour after birth. To overcome the challenges of breastfeeding in the first hour after birth, it is important for mothers to receive support and guidance from qualified healthcare professionals. Lactation consultants, midwives, and nurses can provide assistance with positioning, latch, and milk transfer, as well as advice on managing breastfeeding difficulties. Mothers who have undergone medical interventions may also benefit from early skin-to-skin contact and frequent breastfeeding, which can help to stimulate milk production and promote successful breastfeeding. Mothers who experience discomfort or pain during breastfeeding should seek immediate support and treatment from healthcare providers. It is important to note that while breastfeeding in the first hour after birth is ideal, it may not always be possible. In some cases, medical complications or emergencies may require that the baby be separated from the mother or receive medical care. In such cases, efforts can still be made to initiate breastfeeding as soon as possible, even if it is after the first hour. In addition, some mothers may choose not to breastfeed or may not be able to breastfeed due to medical reasons. In such cases, healthcare professionals can provide support and guidance on alternative feeding options that meet the baby's nutritional needs. It is also important for mothers to be informed about their breastfeeding rights and to have access to resources and support for breastfeeding. In many countries, laws protect a mother's right to breastfeed in public or in the workplace, and employers are required to provide accommodations for breastfeeding mothers. In conclusion, breastfeeding in the first hour after birth is an important step in establishing a successful breastfeeding relationship between the mother and the baby. The benefits of breastfeeding in the first hour after birth are numerous, including immune protection for the baby, stimulation of milk production, and bonding between the mother and the baby. While challenges may arise, support and guidance from healthcare professionals can help mothers overcome difficulties and promote successful breastfeeding. By supporting and promoting breastfeeding in the first hour after birth, we can help to give babies the best start in life. Thank you for watching. Like, comment, and subscribe.